Right, so up until now, we have talked about the bones and the skeletal framework of the thoracic cage, right? So between two successive ribs, we have a space here. Uh, for this part covered by muscle, yes, but this space is what we call the intercostal space. Inter means between, costal, remember I said it means rib. So the space between a rib and a rib is the intercostal space. So they are what we call coverings of the thoracic wall. From the outside, you start with skin, you go superficial fascia. At some point in the pectoral region, you see the breast and the superficial fascia. Then you go deep fascia. Then you see the pec major. I remember the pectoral muscles we were doing in upper limb. You see the pec major, you see the pec minor. If you're on the lateral aspect, you see the serratus anterior. But after you remove all those things, you come across a muscle called the external intercostal muscle. After external intercostal muscle, there is internal intercostal muscle. Then after internal intercostal muscle, there is innermost intercostal. So there are three muscles, external intercostal, internal intercostal, then innermost intercostal. When you do abdomen, you find three muscles again, just that this time around, there is external oblique, internal oblique, then transversus abdominis. That's for the abdomen. But for the thorax, we have these three: external intercostal, internal intercostal, then innermost intercostal. And then after the innermost intercostal, there is a fascia that we call endothoracic fascia. Then after the endothoracic fascia, you reach the parietal pleura. Pleura are the membranes that surround the lungs. And these membranes have a parietal layer, which we call somatic. Then they have a visceral layer, which is closest to the lung. The parietal layer is sensitive to PTTP, pain, touch, temperature, pressure. So it's PTTP. So even when we do the heart, parietal pericardium will be sensitive to PTTP. When we do the gut or GIT, parietal peritoneum will be sensitive to PTTP. The visceral ones are only sensitive to stretch and tear. Right. Okay. So I really don't like teaching these muscles in terms of origin and insertion. It's pretty straightforward. You can see that the muscle is attached on the rib above. It goes to attach on the rib below. Right? So external intercostal originates from the lower border of the rib above, inserts into the upper border of the rib below. The fibers are running like you're putting your hands in your pocket. So they go downwards and medial. Just a way to remember. Right. Then innervation of these muscles, they're innervated by the neurovascular band of that intercostal space. So in intercostal space, we have an intercostal nerve, an intercostal artery, and an intercostal vein. I'll tell you where those things come from. But for now, just remember that the neurovascular bundle, where there's an intercostal vein, artery, and nerve, lies between the internal intercostal and the innermost intercostal. So between the two deeper muscles is where you have the neurovascular bundle in the order vein, artery, nerve, from above going downwards. The mnemonic is VAN, VAN. So the vein superior, then the artery, then the nerve. Right. Then you then have, this is internal. Right, that's your internal intercostal, originates from the rib below, inserts into the rib above. I won't talk about that. Then innermost, it spans more than one intercostal space, right? But there are things that I want you guys to see. The external intercostal muscle does not reach the sternum. So it ends somewhere here, closer to the costochondral joint. Then it's replaced by this membrane going towards the sternum. This membrane, we call it the external intercostal membrane. Other books will call it the anterior intercostal membrane. So external intercostal membrane replaces the fibers of the external intercostal muscle as you reach the sternum. Internal intercostal, as you can see, after removing the external intercostal membrane, you can see that internal intercostal reaches the sternum. But that internal intercostal muscle does not reach the vertebral column at the back. It will also be replaced by a membrane called the internal intercostal membrane. Others call the membrane the posterior intercostal membrane due to location. It's at the back. Right. Then this is the diaphragm. I really didn't want to talk about the diaphragm in this because, but anyway, let's just talk about the diaphragm. This is the diaphragm. This is the most important muscle of inspiration. It separates the thorax above from the abdomen below. In terms of origin, the diaphragm has three origins. It has a sternal origin from behind the xiphisternum of the sternum. Then it has a costal origin. The costal origin is from the lower six costal cartilages. Then it has what we call a lumbar origin or a vertebral origin here, where the crura are, or the crus. So there's a right crus and a left crus. Right crus originates from L1, L2, L3, lumbar vertebra. Left crus originates from L1 and L2. The reason why the right crus is larger is because the right lobe of the liver is larger. So it needs to support the right lobe of the liver, right? Then insertion, the diaphragm inserts into this central tendon, this whitish region here, which we call the central tendon, right? And remember I say that the diaphragm separates the thorax from the abdomen. So things that need to move between the thorax and the abdomen, they pierce through the diaphragm. So we have three major openings and about 9 minor openings. Right? So I'll tell you the major openings, and the minor ones, you can look them up if you want. So you best remember the major openings using this mnemonic CEA. Right. So there is a cover opening at opposite T8. My 8 is just bad. Oh. Then there's an esophageal opening at T10. Then there's an aortic opening at T12. The openings are self-explanatory. Aortic opening means the aorta passes through it. Esophageal opening, the esophagus passes through it. Cava opening, meaning the inferior vena cava passes through it. But those are not the only things that pass through those openings. For example, aortic opening allows opening of things that you remember using the mnemonic ATA from left to right. A is the aorta, T is the thoracic duct, the other A is the azygous vein. Right. Then esophageal opening, on top of the esophagus, you also have the left gastric vessels. So left gastric artery, left gastric vein, those ones you can forget them. We'll do them when we do the stomach. So they're better understood with abdomen. Then the vagus nerves also pass through the esophageal opening. But for cava opening, there is the right phrenic nerve. So it's not both the phrenic nerves, it's only the right one. And I usually teach people the side that C for C, the cava opening is inside the central tendon. That's where the C for C comes from. Right. Okay. Then arteries for the thoracic wall. So remember I said each intercostal space has an artery, a vein, and a nerve, right? So what really happens is, I'll assume you guys know biology, a bit of it, that the heart, from the heart exits an ascending aorta. Then the ascending aorta becomes the arc of the aorta. Arc of the aorta on the right side, it gives us the common carotid. No, on the left rather, gives us the common carotid and the left subclavian. Then on the right, it only gives us a brachiocephalic trunk. The same brachiocephalic trunk would divide into a right subclavian and a right common carotid. So that subclavian artery is divided into three parts by a muscle that you did in your head and neck. The muscle is called the anterior scalene. Right. And I won't bore you with the details of the branches from the first, second, and third part. That can be done in a separate talk. But from the first part of that subclavian artery, there's an artery called the internal thoracic artery. This one. It's called internal thoracic or internal mammary artery. Mammary meaning it also has branches going to the mammary gland, which is your breast. Right. So this internal thoracic artery, it runs a finger breadth lateral to the sternum. I'll show you a dissection video that I have for a prosected thoracic wall, where you can actually see these vessels, a finger breadth lateral to the sternum, plus their accompanying internal thoracic veins. So the artery is from the first part of the subclavian. This internal thoracic artery will supply the anterior intercostal spaces for the upper six. So the upper six intercostal spaces on the anterior side, they get their blood supply from the internal thoracic. Why am I saying upper six? Because this internal thoracic artery, from the sixth intercostal space going downwards here, it divides into superior epigastric and musculophrenic. Gastric means stomach. So that artery is going somewhere to the abdomen. So let's forget it for now. Musculophrenic, phrenic means diaphragm. So that artery is remaining in the thorax. So musculophrenic is the one that supplies the lower 5 anterior intercostal spaces. What did I use to remember? Phrenic means diaphragm. Gastric means stomach. Right? So the epigastric artery, which is the other terminal branch of internal thoracic, it's going to supply the abdominal wall. We'll see it for arteries that supply the anterior abdominal wall. We find it in the six-pack muscle sheath, which is the rectus abdominis sheath. We'll do that with abdomen. But musculophrenic, phrenic means diaphragm. So that one is the one that will supply the lower 5 intercostal spaces. The upper 6 intercostal spaces are supplied by direct branches of the internal thoracic. So that means we have 11 intercostal spaces. Common sense should tell you that if you have 12 ribs, you should have 11 spaces. Because space number 1 is the space below rib number 1. So if you have rib number 12, there is no space 12 because there is no rib 13 to call it a space. Right? So you have 11 intercostal spaces. So on the anterior side, we are saying upper 6 and lower 5. On the posterior side, it's a different story. We say, this is a bad picture. There should be another one. For the posterior side, we say upper 2 and lower 9. Okay, we'll use the same picture. For the posterior parts, the lower 9 intercostal spaces are supplied by branches that come off the aorta directly. So posterior intercostal spaces for the lower 9 spaces, there are branches that are coming from the posterior inter okay, there are posterior intercostal arteries that are coming from the aorta. So aorta will supply the lower 9 intercostal spaces. Right. Then the upper 2 intercostal spaces, they are supplied by an artery called the superior intercostal. So when we really talk about blood vessels in the thorax, that superior intercostal is a branch of the costal cervical trunk. And that costal cervical trunk is a branch of the subclavian. But I'm sure you have done this in head and neck as well. And I remember teaching you guys the same things. So superior intercostal artery, which is a branch of costal cervical trunk, which is a branch of the subclavian artery, the second part to be specific, second part of the subclavian artery, unlike internal thoracic, which we said it's from the first part. Right. Then these are the veins. You also have intercostal veins. But there's something that I want you guys to remember. So in as much as we have an aorta, we don't have a vein that corresponds to it. Right. So we have a system of veins in the thorax that we call the azygous system of veins. Azygous means unpaired. There's no left and right. It's only one. So on the right side, here, we have what we call the azygous vein. It's the one that will receive most of those intercostal veins, the posterior ones. The anterior ones, they go to internal thoracic vein, so they're covered. But the posterior ones, since we don't have a corresponding vein to the aorta, they go to the azygous system. Which veins form the azygous vein? It is formed by union of the right subcostal vein and the right ascending lumbar vein. So I think there's somewhere where they should start lower down here. Right. So right sub let's use this picture here. Okay. Here. A right subcostal vein and a right ascending lumbar vein, they join to form the azygous vein. The corresponding veins on the left, that is left ascending lumbar vein and left subcostal vein, they also join to form another vein called the inferior hemiazygous. That inferior hemiazygous drains into the azygous opposite T8. Then there is another hemiazygous system rather, which we call the superior hemiazygous or accessory hemiazygous. It comes to drain at T7. So all those hemiazygous veins, they come to drain into the main azygous vein, right? And that azygous vein, since it's coming from lower down in the abdomen, because remember I said lumbar vein, it has to pass through the diaphragm. And remember I said things passing through the aortic opening, you remember them by saying A, T, A, aorta, thoracic duct, azygous vein, right? Then the nerves, I wouldn't dwell much on this, but I'll just remind you of what we did when we're doing back and spinal nerves. So what we call intercostal nerves for the thorax are merely the anterior rami of your thoracic spinal nerves, right? And these intercostal nerves, they're going to supply structures in an intercostal space, that is the muscles, the membranes, and so forth, right? They also give you branches for the skin. They give you a lateral cutaneous branch for the skin of the flanks, an anterior cutaneous branch for the skin closer to the sternum, right? I'm just mentioning a few things, not going to town with it, right? And lymphatics of the thoracic wall, just know that ultimately on your left side for the thorax, ultimately it goes to the thoracic duct. The thoracic duct that I said, it passes through the aortic opening. So if you don't want to forget, thoracic duct drains all the lymph from the lower limb, the pelvis and the perineum, the abdomen, then the left thorax, left upper limb, and the left head and neck. The only parts that are not drained by the thoracic duct are the right thorax, the right upper limb, and the right head and neck. They are drained into another trunk called the right lymphatic duct. Right? And these lymphatic vessels, they ultimately drain to the veins because lymph is merely excess tissue fluid that you should take back to the veins after you use your lymph nodes to purify it. Right? Then that thoracic duct, it starts in the abdomen from something called the cisterna chyli. Here's the spelling of cisterna chyli, where I've highlighted that. So the cisterna chyli, it's a cistern is a dilatation in anatomical language. It's just a dilatation around your lumbar vertebra 2-3, L2, L3. That's where the thoracic duct will start. Right. Okay, these are just pictures. So any questions on this? Or things you want me to add for thoracic wall? Or even not for thoracic wall? You need to ask, guys. I always say learning takes place when people ask.